No doubt, as a new personal trainer, you're gonna work with people that have aches and pains and injuries. We've got the oldest member of the Axiom team in here. Dave, what kind of aches you dealing with?
Oh man, you name it, I got it.
and obviously I'm the younger, more handsome version. Hey, I'm broken a little bit myself too, but no doubt, I would imagine Dave doesn't keep his physique by accident. He still trains pretty hard, right?
Yep, and the reality is pretty much anyone you're gonna encounter out there as a client, they're gonna have some kind of pain because pain is human. Honestly guys, if they've been training hard, if they've done any type of athletic endeavor, right? If they're 50, 60, 70, they're absolutely gonna have something, and that's just real life. So the thing we have to figure out is like, what do we do with someone with injuries or pain? And how do we still train them to get some results, Joe?
Yeah, I think the first piece, just mentality. Like pain, as David said, pain is human. It's a signal, right? Sometimes it's a signal to stop what we're doing. Sometimes it's a signal to proceed with caution. Sometimes it's your body just telling you something. And so I think, you know, for me as a new trainer, I can definitely relate to the fact that like I was scared of hurting people. Like anyone who came in, especially if they were older, I mean, I'm a 20-year-old trainer. I'm like, man, give me the 20-year-olds, let's do burpees. And anyone who had like knees and hips and backs, I was like, okay, like I'm really scared. Over time, I've realized that like what we do is the answer. We need to strengthen people. You're gonna do more good than bad most of the time. But also that like people are coming in with fear. If they have had previous injuries, right? This whole concept of kinesiophobia. I still remember when I was at a fitness conference and someone was using this term and I was like, what do you mean fear of movement? Why would someone be fear of movement? And then I hurt my back, right? Blew my back out. And I got back into working out and I was like, oh my gosh, like I'm really fearful. I can feel it. It's like not physical, like I'm scared of RDLs. And it sounded crazy, but it's the reality, right? So these are the things that we're gonna work through, and it's our job as a coaching client, or coaching people. But the cool part is like as we get into this, and what we're gonna try to do here is give you guys a little bit of a framework of how to think about it, how to approach aches and pains and injuries. And you may run into things that are beyond what we get into in this video, but I would say for the vast majority of people you're gonna work with, this mentality and really this approach is gonna serve you well.
I like what Joe just said there too, like it's a mentality, right? Because people are human and they could be out playing tennis on the weekend, bang their knee up, come in the session. Literally from day to day, you never know what you're gonna get with a client as far as like what kind of shape they're in, how well they slept, whatever else, right? And so the mentality is we still have to train the person, right? We still have to help move them towards fitness. We just gotta be maybe a bit more of a sharpshooter about how we go about it, right?
Yeah.
So Joe, what would you say is like the best way to start identifying what I should or should not be doing with a client, right? When they come in and maybe their knee hurts a little bit, or maybe they say they've got, a bad back, right?
Yeah, so I think there's knowing, like people are coming in with previous experiences, previous thoughts about exercises, things that they've maybe avoided over time. For me, my mentality from the beginning is like, I'm gonna focus on what can we do? Yeah. And in my mind, I really am gonna think about a lot of our major movement patterns. Like I'm thinking about pushing, pulling, lunging, squatting, hinging. And what I'm probably gonna find out, or what you might find out in conversation, is there might be one or two of those that are either they are problematic, or they've had some discomfort, or we've had a previous injury. And the most common ones are gonna be low backs, shoulders, and knees, right? Maybe someone they've got, and there's a lot of reason for that. There could be degeneration of the joint. There could be just other movement issues, the hips and the ankles that are causing that. And so in the very beginning, I'm not so worried that I have the answer to all of it, but I'm willing to explore. And so I think when it comes to establishing ground rules, so we're gonna go through all these different movements and we'll give you guys some examples, but I think for clients, especially if they do come in with an injury, like I wanna let them know, cool, we're not gonna do anything that's gonna hurt you, but we're gonna try some things and we're gonna figure out like, what is it? Like you talked about your shoulder has given you some issues in the past. Is it a constant ache that doesn't leave? Is it like when I get my arm above my head? Like I'm gonna be willing to kind of take some time to figure out like, what is it about that that's actually giving you that pain? And then also start to kind of train them on the fact that like, hey, these are good signals for us. We're gonna try to find almost like our menu and our stoplight, right? Of like, hey, things that like the moment we try it, you get like a lot of pain, that's gonna be red. Like we're gonna avoid that. And you can almost think of it as like this 0 to 10 scale. If you get like a 6 or a 7 out of 10 of pain while we're doing these lunges, we gotta find something else. We're gonna stop it. However, if you're like a 3 or a 4 and it's like discomfort, it doesn't feel right, but it's not pain, like, okay, maybe that's a yellow. maybe we're gonna continue to do it, but we're not gonna load it really heavy. And then things that like, no problem, no pain, I feel good, it looks great, green light. So I think there's a component of this, as you're establishing the ground rules, I think letting them know, we're gonna find out what you can do. That is gonna mean figuring out and exploring what specifically gives you pain so we can make sure we're doing the right stuff.
So I think what I hear you saying is we're going to sort of build a mode of communication around this, right?
Yes.
We're going to determine, like, number one, does this thing cause any pain or not, right? If it doesn't cause any pain, we're probably like that green on that stoplight, right?
Yeah.
If it causes maybe like a really light pain or just a little discomfort, maybe like a 4 or something on that scale of 1 to 10, okay, like, we're going to pay a little attention to that. We might play with it a little bit, see if there's a different variation or a different adjustment, right?
Yeah.
So that'll fall into that yellow category.
Yep.
And then if they do it and it's like, oh no, this is not good, or if they just don't feel comfortable doing it, they're like, no, this is not going to work for me, then that's probably a red, right? Like, we're not going to do that at all for right now.
Totally, and I like what you said there too. Like, there's a piece, especially as you're starting with clients, like, you got to build connection, rapport. We do want to explore things, but if someone, like, you can tell, like, they're very nervous about it, they're not comfortable, don't force it. Don't force it. Mostly because chances are it might be an exercise, right? Like, maybe, you know, you want them to step into the hex bar to deadlift, and you can just see on their face. Maybe there's a different hinge, right? I think knowing that we've got other opportunities to explore that might make them actually feel way more comfortable, and you're gonna get a better outcome there because they're gonna give more effort into what you're doing as well.
Okay, so obviously if they're green on something, right, that's gonna be what a big part of our training program is. We're gonna train those things, we're gonna load them heavy, we're gonna drive some outcomes from that. What are we gonna do if something's like a yellow, right?
Yeah.
Because that's kind of that middle, right? Obviously it's not red, so, you know, we can still do it, but like, how am I gonna decide whether or not we keep doing it and like what we do with that yellow exercise?
Yeah, so I think there's a couple things that we're gonna wanna look at first that are gonna allow us to better build our exercise menu.
Okay.
Is first off, explore range of motion and position in many ways. You know, let's say with the, you know, overhead is a real common one, shoulder issues for a lot of different reasons, whether it's bicep tendon or it's how the shoulder blade moves, going directly overhead can be challenging. But so position-wise, is overhead-ish okay? Maybe if I give them a light dumbbell, and even, you know, we're starting, it's like, yeah, no, that's not comfortable, or I get pain. Okay, well, what if we had like a landmine press or a light incline, or maybe it's a band. And again, being willing to try some of the things with obviously very light loads just to see, because really what I'm looking at is range of motion or position, which really just might be exercise choice for us. Is there things that we can do? But maybe we also find, maybe even with something like the landmine, it feels better, but once they get to like here, then we get into more like 5s and 6s of discomfort. So again, we're getting information that it's this kind of extreme angle for the joint that is going to be maybe our yellow or red. And so that's going to help us select some exercises and just get more information. I mean, once again, we're not PTs. We're not going to solve all of it, but the more information, the better. Range of motion is going to be helpful. Another good example would be like lunging, you know, range of motion and position. Maybe for somebody, you know, when they get to like right here is when they start to feel pain in the front or the back. And so, okay, cool. So, I mean, first off, we're getting some training effect here. I can do some
definitely still lengthening, shortening the quad, glutes.
And then maybe it's the position. You know, maybe, you know, changing the stance a little bit.
See that a lot with squats, right?
Yep.
Someone starts getting past 90 and then it's like it starts to load up. Okay, cool. So we can still squat. We'll just make sure that we're not breaking that 90-degree plane, and we can still maybe even load that too, right?
100%. So we're establishing like what's our trainable range of motion with this specific move, and that's going to be good information. And again, that's kind of related to like, is it any joint action with the shoulder, or is it a specific exercise? Like, great example, maybe barbell bench press, you know, hurts the shoulders, but like dumbbell doesn't. Okay, cool.
That's more play there.
Absolutely. Yeah. So we're just we're using this to kind of build our menu of like cans and can'ts and maybe nots. And then just in general, I think something as we're doing this, the lunge is a great example, and squat as well, but the lunge, maybe traditional lunging is kind of challenging and problematic, but maybe, you know, we get them on a supported like step down or step up, which is part of the lunge pattern. Yeah. It's just not specifically a lunge. So you got to think a little creatively here.
So a lot of this is really just good training, right? Like finding you know, a regression, maybe that kind of will be your green until you can move up to that next level, or maybe you don't, right?
Yeah.
So let me ask you this, Joe. it sounds like what you're saying is that we have all these exercises that they're green, they're good to go. This can make up the bulk of our program, and then we're going to have a little bit of some of those yellows where we're going to play with them. How do you know when a yellow moves to green?
Yeah, I think it's a great question. I think, let's say for example, I'll use an example to try to go into it. Maybe like the low back, which is a real common one.
Yep.
Maybe you have somebody, and this could be day one, week one, you're starting out in your program, either A, they're uncomfortable with hinging, or maybe, there's a little bit of low back pain when they do some standing hinging. And so, the movements themselves, the range of motion that they train through can be one, so if you have some problematic movements like squats or lunges or overhead presses, it could be valuable to take some video. Not only so you could talk through with them, but so you can actually compare down the road. Are we getting more depth in our squat? Are we able to achieve more depth in our lunge? Like, there's measurable improvement there. I think the other thing would just be the ability to pain-free do an exercise I couldn't before. Like the low back is a real common one. Maybe we spend some time strengthening the glutes, we spend some time strengthening the core, and maybe all of a sudden we bring that back to the standing hinge, and maybe it goes from a red to a yellow.
Yeah.
Like those are, and I think the thing is, people aren't great at celebrating this, but I think if we can bring that to their light, like bring it to them and show them, then they can see, oh wow, we are making progress in some of these things.
Yeah, that sounds like this measuring improvement over time, right? Because ultimately we're going to try and bring some things back into the menu, see how it works out. If it works out, great. Like, let's put that in the mix. If it doesn't, okay, cool, we'll table it again for a little
100%,
while, right?
Yeah. And I have a client that I'm working with right now who squatting with load and even hinging, all variations, because I'm a problem solver, I'm trying it all. There was mental discomfort, first off, I could always tell, and we kind of worked through some of that, but then there was just some overall like back pain. Through our other things, we spent some time strengthening the legs in general, strengthening the core, all the other component pieces, and we brought it back together, and like the squatting and the hinging, it looks pretty great. We can hinge with a kettlebell now, and now we have something to start from and start to build the strength up there.
For sure. Of course, the first couple months you're training somebody, a lot of it is trying to identify like if they can do the thing without pain, or if they don't know how to get into the right position, or they're weak. So I would imagine after a couple months they're going to build up some strength, and that's going to unlock some new movements, right?
Yeah. So that's where for me it's like strengthening is usually the answer, and the real challenge is like just figuring out how to strengthening. And I think, bringing it back to some of your pattern and building your menu, just don't be in love with one exercise.
And nobody has to do any given pattern either, right? Or any given exercise.
Yeah. I used to think that everyone needed to squat with weight. And I have some clients where like, yeah, we've still worked up to squatting with weight, but like the leg press has been a great tool.
Absolutely.
Mentally for them, they feel more stable there, and then physically we've strengthened the other parts that are necessary for those movements.
Awesome. So Joe, there's a lot of talk obviously, in the scope of practice of a PT, and like you should refer out if people have pain. When do you think is a good idea to integrate with a physical therapist or a doctor or some other allied health professional?
Never. No, I'm just kidding. I think this is a great question. I think first off, if you've done some problem solving and you have some consistent reds, if things are either getting worse, the pain is really limiting your training, or it is day-to-day limiting their quality of life, or limiting what they're doing. For me, that's when I'm like, hey, like we're gonna continue. There's a lot of things we can do and strengthen the body, but there's something else going on here, and we need some help. We need someone who can do some things that I can't. Because sometimes, truthfully, in order to get someone into a better position, in order to increase range of motion, they might need soft tissue work. They might need things like dry needling or other, modalities that trainers, we just can't do. Even though I have clients who would love if I would massage them, I'm not going to do it. So for me at that point in time, and it's not so much just like send them off and like, hey, you go to the PT and I'll see you in like a couple weeks.
Yeah.
They got the rest of their body, and so I think figuring out how can I find a PT who will integrate into what I'm doing, who also understands, because I have found, like everything, like training, there's a wide variety of what you get with PT. So I want to find someone who understands like, hey, this person wants to be training. We live in the world of cans. I need you to help us get to a better place.
For sure. Yeah, I totally hear what you're talking about too, as far as like if it's going to impact their training in such a way where like you can't do what you're trying to do. I have a client who's been wanting to work on his upper body, and after about 4 months of training, he was experiencing some elbow discomfort, like a lot.
Another common one. Yeah.
Super common. But think about it, right? It's going to be pretty hard to build your chest and your back without bending your elbow, and every time it's like it either hurts so much that he can't do it, or you have to decrease the weight. it's going to be hard to get any results, you know, if you can't load it appropriately.
Yeah, so again, as a trainer, you find yourself, what can, you're living in the world of cans, but you might be limited. You're only gonna be able to overload the chest and back so much until that gets better. So I think that's a great example. And I think just for your clients, like some of them are gonna give some pushback, you know, because many of them might think, oh, like, we just do it all? Isn't that what you do too? And you know, again, there's a lot that we can do with strengthening, but like some things I can't. And if we can get you to do this, and again, hopefully it's like, you know, 2 weeks, 4 weeks, 6 weeks, some other more focused approach, then we can train harder in our sessions.
Come back strong.
Yeah, you're gonna get more out of everything in general. And then the other flip side of that is like, this is also just a really great way to build your business with other great professionals.
Yeah, no, that's a really nice side effect for sure.
Yeah, so guys, in general, the takeaway here, pain is human. You're gonna have people come in with aches and pains and issues, and you wanna come about it with the mentality of, I can work with these people, I can work with and around, but we don't wanna just avoid things, right? We wanna figure out, how can I do my best to give them the best quality of life, the best motion possible, so they can get the most out of your training and everything else that they're doing.
That's it. We still gotta train them, we still gotta get them fit.
You got this.